Hey there, Miss Black. Hi, my name's Kylie. I'm going to be your nurse, okay? I'm just going to wash my hands real fast. So as I'm washing my hands, I do want to make sure I do a quick use another room. Make sure I don't see any IV poles or anything hanging up. No Foley. I do notice that she is on some oxygen though. I'll wash my hands. Take a quick notice her husband's in the room. Nothing's on the floor or anything. So I'm going to wash my hands. Miss Black. Hey, can you tell me your name? So she's not really responding to me. She just keeps mumbling her husband's name. He does let me know the reason why she did come in here is because he's having difficulties arousing her. She's been confused. So I'm going to ask him for her name and date of birth to make sure I do have the right patient. He tells me her name and date of birth. I'm going to check it on her band, which is correct. So I do have the right patient. He also did let me know the last couple of days she has been nauseated, vomiting, diarrhea. So I'm going to take a quick appearance on her. Like I said, she's not really responding. She's kind of in and out of it. Her skin looks good though. So I'm going to take a look, and I don't notice any JVDs. I'm going to feel her skin. Her skin is a pale pink, nice, cool, dry. No swelling, no edema. I do notice there is some swelling on her face. So I'm just going to look at that. Some swelling around her eyelids. I'm going to take a look at her eyes. Which her eyes are reacting, but her eyes are red. Let's get her pulses real fast. Alright, her pulse is present bilaterally, very rapid. So I'm going to feel her pulse and count that. Her pulse is 145 right now, which is extremely fast. I'm going to look at her turgor. Turgor is good. Her capillary refills are excellent. Like I said, she's pretty out of it, not really following commands, so I can't really have her squeeze my fingers or pull or anything. Can you squeeze? Miss Black, can you squeeze my fingers? So yeah, she's not really doing anything. I'm going to listen to her lungs real fast. So I'm just going to have her kind of roll over. Somehow listen to her back of her lungs. Okay, I'm going to listen to the front. Alright, so listen to her lungs. I do notice that her lungs are diffuse and crackle bilaterally. So make sure I do that. I'm going to ask her husband, has she been coughing? He says no coughing that he knows of at least. I'm going to go ahead and grab her vitals. I'm going to grab her temp real fast. So grab her temp. And her temperature is 101, so that's high. To her pulse, which I found her pulse earlier, I had got 145, so her pulse is still rapid right now. Go ahead and grab her blood pressure, put it on her arm. I will listen to her blood pressure. For that, I got 120/76, which that's good, that's normal. Her respirations, I did get 32 for that though. Like I said, she was on oxygen. She's on 4 liters of oxygen, and even with that, she's only statting at 89% on her 4 liters. So she can't really ask me questions. I would make sure I would ask her husband just about why she came in, which she told me, diarrhea, vomiting. She's been very anxious ever since she gave birth to their child. I would ask if she's on any medications, if she has any diseases, family history of that. mental changes besides today with the razzle. He did let me know that she is hyperlipidemia. She has Graves' disease and she does have asthma. He did let me know that she is taking simvastatin, PTU, and she does have a rescue inhaler for her asthma. So make sure to just document everything. Do you need anything before I leave? Make sure he has call light. Do that. So I'm going to take a step back. Alright. Hi there, Miss Black. It's Kylie again, okay? So the doctor did order. We're going to grab an EKG on her because we're going to intubate her to help protect her airway since she is on 4 liters and candistatin fast and her respiration's fast. So I'm going to hook up the EKG, do a 12 lead, make sure I place my leads in the correct place, grab that real fast, call the respiratory. Respiratory came in to intubate her and make sure to have all the drugs. I would check her ID bracelet. I would have her chart up, have everything set up for the intubation. Respiratory came in, noticed that her thyroid gland is swollen, so we do have to call the anesthesiologist to come in to intubate her. So I'd make sure I would call them, notify them, let them know what's going on. So they are now in the room. They have intubated her. So I want to make sure that I document everything, what medications we gave her to kind of put her out so we can intubate her, what size tube we used to intubate her with, the number that's at her lip for the intubation so we know if it moves or not, who did the intubation, why we did it, time and date for that. So we do have her nice and intubated now. And we are also going to grab some labs. So we are going to do a CBC, CMP, LFTs, and we're going to also do an ABG. We need to see where her gas levels are. I'm also going to make sure I call the ICU since now she is intubated. She's more critical. So I'm going to call the ICU floor and give them a report on her real fast. So I'm going to step out of the room and make sure that she has everything, and I'm going to go give the ICU report. Alright. Hey there, Miss Black. Alright, it's Kylie again. We're going to be moving you, okay? I will let the husband know why we're moving her and where she's going. So we'll get her all packed up and moving. So we now have her at the ICU. Once we got up there, her lab should come back. I would just let them know what her labs were. Her sodium was 144, pH was 7.33. Her thyroid TSH was only 0.1, potassium was 5.0, her CO2 was 48, her white blood cells count was up, it was 14, magnesium was 1, HCO3 was 24, her hemoglobin was 12.5, BUN was 11, PO was 190, hematocrit was 38%, creatinine was 0.7, lactose was 3.2, and her platelet was 450,000. So we have that. So now she's in the ICU. And the doctor has prescribed some medication for her, Sopranolol. So I'm going to go and grab that. And he also had prescribed some normal saline through the IV. So I'm going to go ahead and go grab my medications. Okay, so knock on the door. Hey there, Miss Black. It's Kylie. I have some medications medications for you, okay? So before I brought the medication to the room, I want to make sure I do my 3 checks, make sure I got the right medication for the right patient. I'm going to pull up her MR to check again. I'm going to check her bracelet because she is intubated and can't tell me her name and date of birth. Check it with the medication, which does match up. I'm going to make sure I have the right patient, right medication, right dose, right route. I'm going to make sure she doesn't have any allergies to these medications. So first I'm going to give her her manual for her irregular heartbeat because she did go up to 155. So we definitely want to slow her heart rate down. I would make sure that I will keep an eye on her heart rate to make sure it doesn't go into an irregular rhythm. Make sure it doesn't go too low. This medication can cause constipation and diarrhea, but since she is intubated, we'll just have to keep an eye on that one. So I'm going to go ahead and wash my hands. Wash my hands. Got the medication, get my syringe. So I'm going to have grab up the medication, which we have 1 milligram. So I'm going to pull up the 1 milligram of medication. Alright, put my gloves on real fast. So, for her IV, I'm going to check her IV. Check the dressing, make sure it's not red, tender, swelling. The dressing's nice and dry. Doesn't appear, the dressing's contact doesn't appear to be a bad IV. So I'm going to clean off her hub. So we'll clean this off. I would grab a normal saline flush first. I would hook it up to the IV, flush at least 2 milliliters of the solution in. I'm going to check the patency of her IV as I do that. Make sure it's not leaking, but the IV is good before I give her the medication and waste the medication. IV's good. Go ahead and clean that off again. I would take her medication, hook it up to her IV. I'm going to push this over a slow period of time. As I do this, I would look at the monitor to look at her heart rate. So I push this. Okay, about a minute. I'm done with that. Wipe the hub off again. I would take a normal saline flush, hook it up to the IV, flush that, but make sure to go slow with that to make sure all her medication is given to her and none of it's in the tubing. Once I flush that, I would clamp her IV, clean up the hub. I'm going to document time and date, the medication I gave, how much I gave it, her response to it, and how I gave it, IV. And then, like I said, she also had an order for an IV normal saline solution. So I have that. I'm going to make sure I have my normal saline. The doctor did order the 0.045 normal saline. I'll make sure that my bag matches up with the order, which it does. I would make sure, once again, check my patient. So I'm going to grab my bag. I would spike my bag. Make sure I prime my tubing before I put it in the pump. So prime my tubing. My tubing's nice and primed. I would hang it up. I'm going to put this part into my channel. I would make sure I have my IV pump set up to give her 100 milliliters every hour of the normal saline. So I put that in. Like this. I'm going to clean off her IV. Clean off the hub again. I would take a normal saline, just flush it just to make sure her IV is still good. I would hook up her IV. The IV's hooked up. And then I would just make sure I hit start on my IV pump and let this run with the normal saline. Okay, and I would document that too, time and date, how much I'm giving her, where the IV is, and the solution I'm giving her. So I have that all documented. And then, so her husband's asking me what would cause her to have this thyroid storm, which I would let him know. Just a lot of times it's caused by stress. So the delivery of their child could cause this, the stress on her body and stuff. I would educate him as far as the diagnosis, let him know what's going on. Make sure document that I did educate him on it. Before I left the room, I make sure that she's okay, that there's nothing laying on the floor, that she has everything she needs. Make sure the husband's doing okay too. So put all that stuff away. Hey there, Miss Black. Hi, hon. My name's Kylie. I'm going to be leaving, okay? I'm going to give Ashley a report. Let Mr. Black know that I'm leaving, that I'm going to give Ashley a report. So I'll give Ashley a report. So Miss Black is a 31-year-old female who is postpartum. She was brought in today through the ED by the ambulance. Her husband had called 911 after difficulties of arousal and confusion. He had also stated that she has been very anxious ever since she's given birth to their child. She's also has had nausea, vomiting, and diarrhea for the last 2 days. She has a history of hyperlipidemia, Graves' disease, and asthma. She takes Simvastin and TPU, and she does have a rescue inhaler that she does take as needed. Upon admission, her vitals were 101, 145, 32, 120 over 76. Her oxygen was 89% on 4 liters. We did grab an EKG because her heart rate went up to 155 with irregular heart rhythm. We did intubate her since she was desaturated and to help prevent her airway. Anesthesiologist did have to come in to intubate her because her thyroid gland is swollen. Her labs, her pH was 7.33, her TSH was 0.1, PCO2 was 48, HCO3 was 24, PO2 was 190. White blood count was 14 and lactate was 3.2. I did give her propranolol for her irregular heart rate. I gave her 1 milligram of that through her IV. She does have that ordered for 3 times a day. She does have a left IV in her forearm. That's an 18 gauge. She also has normal saline running, 4.5 normal saline. That is going at 100 milliliters per hour. I have updated her husband about what is going on, so he's informed. Do you have any questions about anything? Okay. All right, Miss Black, I'm leaving. I'll see you in the morning, okay? All right.